My name is Jen DeMaio, and I'm a licensed acupuncturist here in Moorhead, Minnesota. I just heard my Minnesota accent come through on that. My husband, Steve Spader, and I own Two Turtles Acupuncture Center. And we've been in practice here in Moorhead. This is our 10th year, but we've been in practice total. It's been 14 years. And I have a bachelor's degree in biology and psychology, and then my master's degree is in acupuncture and Chinese medicine. So it's a 3 to 4 year program outside of your bachelor's generally. There's 20 or 30 schools nationally that graduate acupuncturists. There's 2 in Minneapolis. I went to the Oregon College of Oriental Medicine in Portland, Oregon, and I graduated in 1999. And hung out west for a while, and then in 2003 headed to the Midwest. I grew up in Fargo, and I was pregnant with our first son and wanted to live here near my mom. Fargo was not the location I wanted to end up in. I was hoping to be closer to the cities, but it's been good. Yeah, and like I said, we've been here for 10 years. This summer will be our 10th year here. Having grown up here, I had never heard of acupuncture ever. And then I went to a really small school in a small town in Kentucky where, again, never heard of it. And I was getting into my senior year of college looking at pre-med, possibly a PhD program in genetic counseling. And I had a teacher recommend looking at alternative medicine because I've always been kind of on the fringe of alternative lifestyle. You know, back in the day it was punk before punk was cool, and grunge before that was cool, and did lots with like recycling and ecology. And a professor was like, I'm not sure Western medicine is really going to be like just kind of nourish your soul. And genetic counseling too, I mean, you're in Western medicine. And so he encouraged me to look at acupuncture and naturopathy, and I had never heard of either one. But he had, and got me resources, and it was like just finding something that fit every part of me. Like every belief I had about how the body works was just really fit Chinese medicine. And that's what then took me out to Portland to go to acupuncture school. The basic concept in Chinese medicine is that everything's interconnected, and everything affects our health. So what we eat, the state of our mind, how we engage in our environment, so how our relationships are, how we interact with our children, do you find joy in life. The external environment affects our body. If there's toxins and pollutants in the environment, Chinese medicine believes too, you know, like not to go out hot and sweaty on a cold winter day because the cold will actually invade your body. So you can engage with the environment that way. But it really brought together that whole concept that like we are a whole person, mind, body, and spirit. And so if we're having like a spiritual crisis, we can have a physical ailment. If we're having a physical ailment, it can lead to emotional distress. And I had that belief, and I really enjoyed learning more about acupuncture and Chinese medicine because it fits into that body, mind, spirit concept. But like I said, the basic idea about how acupuncture works is that we have this thing called qi that flows through these pathways. And we have all these pathways that flow through our body, and this thing called qi, or it's like energy, flows through these pathways. And it flows through the pathways to nourish all of our organs, so all of our bodily systems like circulatory, nervous system, endocrine system, the lymphatic system. All of those systems are being nourished by this qi. And we need it to flow smoothly throughout those pathways so that all the cells, all the glands, all the organs get their nourishment. And what happens though is the world around us creates blockages. So your emotional state, the way you manage your stress, what you eat, what you drink, environmental toxins or pollutants, or injuries can all cause blockages in the energy flow in those pathways. So it's like putting a kink in a hose. And we want to unkink the pathways, because when you kink a hose, the water bulges on one end and then not enough flows through the other. And it's the same thing in this pathway system. That energy or that qi would bulge on one end and give too much to certain systems, and then not enough would trickle through on the other end of the kink, and then other systems would be left with a deficient state of energy. And so we're trying to figure out where the blockages are and what's causing the blockages to prevent further blockages. And like I was saying with the acupuncture, we're choosing specific points to balance out that flow of energy, to help the kinks relax, to bring nourishment back to the undernourished areas, to disperse the energy where there's been too much. Environment, so toxins, pollutants. We live in a really clean area, so that's not the biggest issue. But how we manage our stress, so what we think and we feel can cause kinks. What we eat, what we drink can cause kinks. And any sort of physical injury. And for some people, lack of activity can cause kinks. People who are not active and don't get any exercise. And so with acupuncture, not only are we doing treatment with the needles and, you know, bringing balance back to that energy flow, but more often than not, when I'm engaging in conversation with my patients, I'm talking about, well, what does it look like when you have stress? Like, what do you think? What do you feel? What foods are you eating? How can we nourish you more? So not only are we doing the acupuncture to unkink that flow of energy, but we're also figuring out how can we better bring balance to the body with what you're eating, what you're drinking, what kind of activity to engage in. So my definition of health and wellness would definitely be that there's a connection between our body, mind, and our spirit, which is what drew me to Chinese medicine. And so seeing that person in as a whole person. So we talk about holistic medicine, and acupuncture and Chinese medicine is holistic. And what that really means is that the analogy I was taught early in acupuncture school is that the body is like a tree. And people come in with all these symptoms, which are all the branches. And we're used to going to the doctor and getting something for that symptom and something for this symptom and something for that symptom. But in Chinese medicine, we're like, hey, let's collect all this information and figure out what's the root. And then by treating that root imbalance, we can affect all the symptoms or all the branches. And so I loved that, because that is exactly how I thought health and wellness should be, is that there has to be a connection between everything that's going on in our body and our organ systems and the bodily functions like the nervous system, the endocrine system, and that what I was thinking and feeling could have an effect, and what my body was experiencing could have an effect on my mind. And I just loved how it incorporates that whole concept of holism or holistic living, because there's that understanding that it's all one. It's not separate things that we're experiencing. We can figure out what the root cause is and then treat everything that's involved. And so in an acupuncturist view of health and wellness, it's this whole lifestyle that we're talking about. But I also like to let people know that, like, if we could look at it like an 80-20 sort of thing, like 80% eating well, managing our stress. I mean, life happens, and so there has to be time where 20% or 30% or 40% you're like off your game, you know, but most of the time you're engaging mindfully with your life and with your family and food choices. So when people come in for acupuncture, at the first visit, we spend about an hour to an hour and a half with them. They receive, we go through their health history, so we spend a lot of time asking questions. And then we do our exam. And in Chinese medicine, there's two traditional diagnostic techniques that we use. One is feeling the pulse, but we would basically feel the radial artery, and there's 3 positions per wrist. So each side has 3, so there's 6 positions total. And each position corresponds to a different organ system. So the way the pulse feels tells me more about how the organs function. So I'm feeling for, like, does it feel like a thin piece of thread or a tight guitar string? But there's like 30 qualities a pulse can have. So when an acupuncturist feels a person's pulse, they're feeling for that quality or the sensation. And then we look at the tongue, and the organs are all mapped on the tongue. So we look at the color, the texture, your tongue coating, and that gives us more information about your organ function. And everything in your health history, all the questions that we ask tell us which organs are functioning well or which ones are having an imbalance. And then you'd get your first acupuncture treatment where we put the needles in certain points, and then you would rest. And you rest for about 20 to 30 minutes. And people typically come to us in an acute state. So something is irritating them enough or affecting their function in life enough that they want care. And so we call that relief care. They're having more frequent symptoms that are disrupting their way of life, and so they need to come in generally more frequently in the beginning. So we would say 1 to 2 times a week in that relief care area, but as people improve and their symptoms improve, we spread the visits further and further apart. So if you start off once a week, you might do that for like 4 to 8 weeks, and then you'd go to every other week to once a month. And our goal is to help you maintain a better state of health throughout the lengthening apart, so that you don't need to come back every week for the end of time. You come back when you feel like you need a tune-up. So if we talk about how acupuncture in Chinese medicine helps with different ailments, it kind of goes back to that concept of that tree that I talked about in the holistic component, that if we get to the root cause of a problem, and let's say the patient's coming in with headaches, but they have poor sleep, I find out they have low energy. If it's a woman, maybe she has menstrual irregularities. I can affect the main complaint of headaches, but I can also help support all the other symptoms she may have by knowing what that root cause is. And the way we find that out is through that exam, through that first visit, by going through the health history and doing the different diagnostic techniques. And so regardless of what your symptom is, or your chief complaint we call it, we're able to support so many other symptoms that might come up in that exam. I get asked this question a lot, is what does acupuncture treat? And I tell people generally it treats pretty much anything you'd go to your primary care doctor for. So what we see a lot is body pain, and we see headaches, digestion upset. I see children with sleep problems to behavioral disorders. We work with women with fertility, needing some fertility support, any sort of menstrual imbalance, whether it's endometriosis or perimenopause, menopause symptoms. So you can see it's really going to blanket most things you'd see your primary care doctor for. It lowers your inflammatory response, it lowers your stress response, is what the acupuncture does naturally. So it promotes more energy, it improves your immune function. So if you have bad allergies or frequent colds and flus, acupuncture can help with that as well. So most anything acupuncture can treat. It's rare to find something that I'm like, oh, it's contraindicated. That would be more if we were working with herbs. We have to pay really close attention to medications that people are on when we're starting to do herbal formulas as well.